Welcome back to Action News 5 at 4. We are all packing school lunches, getting our children ready for the school year. And today, dietitian Christina Turner is here to share some tips with us. Christina is from Baptist Memorial Hospital. Thank you for being with us. You have an excellent display here, and I know you broke it down in the sides, but what are some of the things, because there's so many choices that parents should consider when they really want to pack a healthy lunch?
Well, the American Heart Association recommends that parents start packing lower sodium foods this year. That's what we really want to focus on, lower sodium and lower sugar.
Right, because I believe, like, if we look at this side right here, tell me how this side works. I look at what my kid would want, which would be a can of Coke, and it's got like, wow, 2% sodium and 13% sugars.
Yes, this is the side that we have all of our bad foods. So these are our sugar sweetened beverages,
Okay,
and
so
that
Coke
includes
bad.
the juice. Yes, and it's also the juice. Most people aren't aware that juice is a sugar sweetened beverage and can have just as much sugar as a soda.
Really? What about me ask you about, like, if you're packing 100% juices, is that better than a sugar sweetened, or is it just about the same?
They're about the same. I mean, we would recommend 100% over, mixed juices, but a half a cup is about the max for juice per day.
All right, so now when we're making that choice, I see you got everything up here display. If I'm a parent and I want to make a good choice and I want something that my kid's going to eat, how do I go about that?
Well, we have some delicious items here that's pretty fun. We have some yogurt that's really portable. Kids like the flavor, cheese, granola bars. These are fun little dippers. Kids can have fun dipping them in the sauce. We have some baked chips. So we have some items here that are fun. These are in a nice shape that kids can enjoy.
I know you talked about keeping the sodium low, the salt, and the sugar low. Yes. The protein. We just reported a couple of days ago about how a third of kids aren't getting enough protein. Yeah. Peanut butter, a good source of that?
Yes, absolutely. Peanut butter, even the almonds there, the yogurt, the cheese, these are all good sources of protein. Also milk, yeah.
Now, here's the tough question. How do you get the kids to make sure they're going to eat the healthy foods?
Get them involved, yeah. Take them to the grocery store with you. Let them pick out their own food. Let them pick out a lunchbox that they like. Get them in the kitchen and help them prepare the lunch for the next day. They're more likely to eat it if they're involved.
All right, and are there any recommended guidelines that, bullet points just quickly that parents can keep in mind to be healthier?
Yeah, for kids under 13, we want to recommend 1,000 to 1,200 milligrams of sodium a day. And for kids under 13, about 3 teaspoons of sugar a day.
All right, thank you so much. 3 teaspoons.
Yes.
Wow, and there's like 7 in that can of Coke.
Yeah, or more.
All right, thank you for the information. Well, parents, we want to warn you about aspirin is one of the cheapest and most common drugs on the market. And now there's more scientific proof that it could be a true wonder drug. Lindsey Brown reports on the benefits of aspirin.
We've long heard an aspirin a day can help prevent heart attack and stroke. Now you can add cancer prevention to the benefits.
That's the nickname for aspirin, the wonder pill, the wonder drug, because it does so many things.
The new study from Queen Mary University of London finds over a period of 10 years, aspirin can cut bowel cancer incidence by 35% and deaths from the disease by 40%. Esophageal cancer rates drop by 30%, deaths by 50%. Stomach cancer rates were down by 30% and deaths 35%. Though not as strong, there's also evidence of a reduction in lung, breast, and prostate cancers. Still, Dr. Castellaw with Baptist Medical Group has a strong warning for anyone thinking about starting an aspirin regimen.
People hear about these reports and say, oh my goodness, I need to go get on an aspirin. But aspirin can also have a lot of side effects, especially gastrointestinal side effects, bleeding, hemorrhaging. So it's not a totally innocuous drug.
This new study, though, shows that benefits can outweigh those risks in some patients. But Dr. Castellaw says a doctor needs to make that determination.
No one should just start taking aspirin unless they check with their doctor and make sure there's no contraindication with any medicines that they're taking right now.
The London research team found it took about 3 years to see any health benefit of daily aspirin, and ideally, they say, one would take between 75 and 100 milligrams for at least 5 years to get the fuller effects. Lindsey Brown, WMC Action News 5.